Hey, this is Don with Poseidon Deepwater Outdoors. Here on the channel, we're trying to give you information, tech tips, training, and even health issues. Let's discuss them openly and kind of give you what the known facts are and the relevancy to you and your diving. Today, I want to take a little bit of time and talk about IPE, or Immersion Pulmonary Edema. All right. In general, let's talk about what it is and why this is something that you need to be concerned about in your diving. Pulmonary edema in general is just fluids that are collecting in the alveoli. This is, in the case of immersion pulmonary edema, it's fluid that's secreted from the blood. What happens is when you have your alveoli look like little grapes, all right? And the capillaries run along those bulbs over the sac. Both incoming blood that's oxygenating and outgoing blood that is, oxygen poor. So what that does is have a balance to it. Now you have a vascular static pressure as well as a pulmonary pressure. So that the pressures inside your lungs sometimes can be different than the pressures inside your vascular system, the vascular system being the blood vessels, capillaries, and arteries, the pulmonary system being your breathing system. So obviously, right, your heart pumps, has a certain pressure rate that metabolically your body is used to, and then your breathing and the air around you atmospherically has a certain pressure. So you can already kind of see in the mix how things can start to get kind of turned upside down pretty quickly. So the reason why this is important to you is because it's a growing concern in an aging scuba diving community. All right, this isn't something that just happens tech. This is becoming more and more frequent on lower level dives, anywhere from the 15 to 20 meter mark. Recently, there's been quite a few cases. This is something that's definitely an emergency and can even cause death if not treated. The way you really need to handle this is through self-assessment. When the symptoms start appearing in yourself, you've got to be, aware of what you're being faced with. We're going to talk about some of those symptoms. And you need to also prevent this in some of the preventive actions when we talk about how or what some of those factors are that make you at risk for IPE. Now, shortness of breath, and that intermediate to going to the extreme, you'll get a fluid coming out of the mouth, coughing up a fluid, a pink foam, usually with IPE, all right? And what that is when the fluid, you guys have seen when your blood spins down, you have plasma, right? The fluids that are based in the plasma part of your blood will start to secrete through and permeate into the alveoli, which means it'll start to fill up with fluid to displace that pressure difference, okay? So your symptoms is going to be shortness of breath. You might think that, hey, it's kind of hard to breathe, and then, hey, there's no current or anything. Hey, you need to start being aware. Coughing, right? Spasmodic coughing. Once you get them on the boat, they could be cyanotic or blue in the lips and, the pale skin, bluish tint, okay? And when it starts to get more progressive in its symptomology, you'll start getting more spastic and harsh coughs with sputum, red sputum, and fluids, difficulty talking, cyanosis, dizziness. Now, some of this stuff, other than the coughing and the fluids, does sound a lot like DCS, doesn't it? In certain aspects, especially when we're talking about, pulmonary conditions associated with decompression, illness, or sickness. So when we are aware of any kind of factor, not knowing exactly what it is, we need to cut the dive immediately and start to ascend. Now, the treatments are, you get them on the boat, cut the dive on the boat, initiate the EMS system, put them on O2, get them to the hospital. Now, the minute that they're on O2, if they're in the lower spectrum of the condition to intermediate, you're going to see improvement of the condition of the patient or the diver. That doesn't mean you stop. That doesn't mean you don't go to the EMS or go to the emergency room. So that just means, hey, the condition's improving, but they still need to be assessed. Immersion pulmonary edema, a lot of the risk factors involved in this are obesity, high blood pressure, right? Now, here I am, I'm talking about an aged diving population, but do you know where this was first found? Healthy young buds candidates in the Navy SEALs program and triathletes. This and very, very avid, healthy free divers get IPE pretty regularly. So they're saying 1 to 2 out of every 10 athletes or triathletes will get IPE at some stage or some form of it. So I don't know that health or age is a huge factor. In my opinion, some of the things that we can do, right? Now, blood pressure definitely has a key factor in this, all right? Now, if you can maintain your weight and control obesity, you're going to control blood pressure, which is going to reduce overall risk. Other factors are hydration levels, but not underhydration, hyperhydration, all right? So those that are slamming 2-3 liters of water right before a dive have a lot of fluid available in their system. When you start having those barometric pressures in your metabolism or your physiology, now you've got more availability for the fluids to come in. So, what we would recommend is, a liter over an hour before the dive. Also dive position, A lot of recreational divers want to dive in that semi-vertical position. And what that does is your chest being higher, the heart being higher than the lower parts of your lung, right? There's a differentiation, even though it's less than a foot, right? Less than, a third of a meter, a quarter of a meter, you have pressure changes, and it's just enough static pressure change to allow the conditions to start to become relevant and start to become symptomatic. So, we want to ensure that we're diving, in the correct buoyancy control and trimmed position to where all parts of our body are at the same level, so we have the same pressures across. That'll help. There's some scientific studies. There's a lot of, the Navy obviously and NOAA are doing a lot of studies with the IPE, coming out with some great information related to some of the causes, and there's even some studies in prophylaxis. Prophylaxis meaning, some prevention. There is some, a particular drug that they're studying for, taking pre-dive to reduce this type of symptom. Now, I'm going to say this because it's funny in the drug that they're saying. I am not in any way saying that this is something that you need to be taking, because this is a study. The research is being conducted on it, and you need to talk to a doctor if you're in any symptoms, and you don't take any medications as a prophylaxis for IPE without the direction. But the studies are actually kind of being centered on Viagra, believe it or not. So, and the dosages are confidential, so, the dosages that we're talking about it's funny, that's what it is. So, they're out there doing some study as it arises and more research, just like DCS and DCI was back in the day. One of the attributing factors that they're saying is into the increases that it is being more properly diagnosed across the dive community, both military, commercial, and recreational dive community, that it's, now being caught and diagnosed appropriately. So when we're talking about a cut and a dive, you can see that how in recreational IPE has probably, this is an emergency. This is a life-threatening condition no matter what you're talking about. But because you don't have a soft hard deck like you do, or a soft overhead like you do in technical diving, you can just start to do a controlled emergency ascent and get on O2, and you have a better chance of survivability. While on the technical diving, what you have to do is you have to weigh out the odds of, okay, now IPE is in the equation, IPE versus DCI. Okay, so you're weighing different odds, and these are all considerations that you need to take and put into your dive planning specifically for tech diving. Now, as tech divers, we try to make sure we're prepared for all contingencies, but seriously, is this something or a condition that you've even contemplating have any type of contingency on your tech plan? All right, I'm gonna go ahead and wrap that one up. This is Don for Poseidon Deepwater Outdoors. Hope to see you soon. If you like the information that we're giving out, please subscribe. Click the like button. Stroke my ego a little bit. And until next time, peace.